Hi everybody, this is Ben Sturbo with Dr. J. Hartley at Hartley Chiropractic and Scoliosis Center. Today I'd like to talk a little bit about Harrington rods and back surgery for scoliosis. So Dr. J, could you explain what the Harrington rods are and how they work?
Sure, Ben. The Harrington rods are basically, they're on each side of the spine and they're screwed into the spine to make adjustments to actually correct the curvature. So depending on the size of the curve and the flexibility, they're going to try to basically take all the curve out with the rods as much as they can, and they'll usually start to do that about the time the person stops the growing, which is about 14 years old. If the curve is threatening to really be a large curve, they may do the surgery earlier than that, and with the idea is the rods are actually preventing the growth of the larger curve, but usually it's after the curve's already gotten big and the rods are reducing the curve down. And they're basically, there's a screw on at each vertebra on each side of the spine, and then the rod is connected to those screws.
Is this a safe procedure? Is there any risk involved?
Well, like any surgery, you have infection.
Mm-hmm.
And there can be side effects, but surprisingly, when it's done in an adolescent, consider the massiveness of the surgery. I mean, sometimes it can be a 4 to 8 hour surgery.
Yeah.
The side effects of actually having the procedure, believe it or not, the survivability is pretty good. But if you were to watch the surgery, it's pretty crazy. I mean, they take calipers and they'll go into where the facet is of your lumbar spine and thoracic spine, and they actually are pulling out the posterior facet, all the ligaments in the joint. They just pull it out with like a pair of pliers. And so it's amazing that, you know, people aren't functioning at a very low level, you know, after you see how the surgery's done. Now, people will tend to have loss of flexibility because of the fusion, but not as much as you would think. A lot of the risks are further down the road. You know, if the person gets into a car accident and the rod breaks, if a screw backs out, and then they have to decide, you know, how are we going to handle this? Because the surgeons typically don't want to do a second surgery on somebody with any kind of surgery, but with back surgery, you'll hear them use the term fresh backs and necks. Like they would like to decide what they're going to do, get in there one time and do it, and then nothing ever goes wrong, right? That's like what they want to happen. But, you know, it always doesn't work out that way.
So are the rods an absolute cure for scoliosis? Is it something that you'd recommend?
Well, we only recommend it in cases where the progression looks imminent and it's going to be a very large curve. In the last couple of years, we've started to refer more for opinion on tethering, which is where they put a strap next to the spine. It's also screwed in, but as the spine grows, and this would have to be done at ages like 11 to 13 is the optimal age. As the spine grows, it actually straightens the spine, and then the person still has flexibility, because rather than rods in there, they have a strap in there. And so Philadelphia Children's Hospital is the Shriners Hospital is the place where most of the innovation has been done on this. So we have referred people there, and but we only refer severe cases. We do have a 90-degree curve that we did refer there, and they were able to reduce it down to 20 degrees. The patient is still growing, so in their case, it's still reducing down the curve, and hopefully, you know, they will continue to go along without side effects.
Are there any complications that can occur after a spinal surgery and problems that can just appear?
Sure. I mean, we have one patient that is unable to extend their neck because the rods, they had a high thoracic curve, and so the Harrington rod actually comes up into their C7T1 area, so they can't move their neck back because the rod's actually right there stopping the motion. People tend to have more hip problems because if they're fused from T1 to L5, a lot of the stress goes onto the hips. So if you have any misalignment in the hips, it's going to tend to degenerate more. The rib arch, if you're getting the surgery because you don't like the rib arch, so when a scoliosis patient bends forward, you'll see a visible rib arch. The Harrington Rod surgery does not remove the rib arch, so if you're getting the surgery for cosmetic reasons due to the rib arch, it's not going to solve that particular problem.
And are there any alternative treatments to this surgery to correct scoliosis?
Well, the clear method was developed as an alternative to rods, and it's a process called mix, fix, set, warming up of the spine, specific adjustment. Set is specific traction and exercise to get the adjustment to hold. And our goal is to get a 30% reduction of the scoliosis. So if the person has a real small curve, 25 degrees or less, they may get below 10 degrees and no longer have scoliosis. If the curve is 25 to 40 degrees, then we're hopefully looking at a reduction of the curve and stabilizing it to where it doesn't progress and to get worse. And then there's also the Scolibrace. It's a new innovative brace. It's a three-dimensional correction, and we recommend that in cases where the patients previously may have been referred for surgery.
Okay, thank you very much everybody for watching. For more information on this scoliosis treatment, visit drjhartley.com. Also watch our other videos on scoliosis treatment for adolescents and adults. Subscribe to our YouTube channel, Hartley Chiropractic and Scoliosis Center, and thank you very much for watching.
Thanks, Ben, and make sure you go out there and make yourself a great day.